Okay, so today we are going to talk about Paget's disease, and Paget's disease is named after Dr. Paget. So let's go ahead and take a look. So what is Paget's disease? It's a condition in which there's excessive breakdown and rebuilding of bone, causing overgrowth and deformity of bone. So if you remember in osteoblastoma, we said basically you just start growing bone. If you recall when we said in osteolysis, you start breaking down bone. In Paget's disease, we're breaking down and rebuilding bone. Okay, and you get an overgrowth and deformity of bone. So it's almost like when we talk about osteosarcoma, where we were saying that we were breaking down bone and getting a weak set of bone. Paget's disease is similar to that. So with Paget's disease, the area of the new bone is larger, but it's weaker than the other bone because it's immature, just like we saw in osteosarcomas. We're breaking down bone and we're growing new bone, and then it's being broken down before it has a chance to mature. So, okay, it can affect one bone or several areas of the bone, and also several areas of the body. So you can see it's in the back. We can get it in the skull. We can get it in the arms. We can get it in the legs. A lot of times with this, and it's going to be coming up, people don't even know they have it. But in the lytic phase, remember we said in osteolysis, you're breaking down bone with osteoclasts. These would be osteoclasts that are right here, right? So we're breaking down bone. Then you have the mixed phase, in which we're also rebuilding some bone, right? And then you have the sclerotic phase, which is where we have the weak bone. Many times it's diagnosed because people are getting an x-ray for something else. A lot of times people won't even know they have this, especially if it's in the skull. They won't even know they have this. But it can also cause enlargement of the skull, which we'll see in a little bit. Okay, cause is unknown, but it may be due to genetics or viral infection in childhood. I don't know what virus has actually been associated with this or why they think this. Genetics may play a role simply because of the fact that people, it's genes, so it could have a genetic component. Maybe it runs in families. The symptoms, bone pain. And here you're going to get the bone pain again because of the fact that you got the weak bone and you have something going on with the bone. So it can be painful. An enlarged head. This is not a fake picture. This is an extreme case that could happen to some people. Here's the one thing. I don't know why his nose got so much larger, because the nose is not bone. Okay, but this poor guy, this would also be painful too because of the fact that of what you have going on with the bone. Probably very hard to walk due to a loss of balance. There was a movie back in the 1980s called Mask, which was a true story about a boy who had Paget's disease and what he faced as he went throughout his life and how schools didn't want him and things such as that. In fact, it starred Cher, the singer. And this is a picture of the boy. Like I said, the movie was called Mask. These are extreme cases too. Like we said, most of the time people won't even know they have this. You can get fractures. The reason you get fractures is because of the fact that bone breaks down and it's replaced by weaker bone. So you can see this is the fracture right here. Okay, like we've seen in other diseases that where you have bone remodeling, fractures are not uncommon. Hearing loss. The reason you get hearing loss is because the bones in the ear, you have 3 tiny bones. If those can be affected too. Remember, like in osteogenesis, we said that these bones could actually break and lead to hearing loss. Well, here is again, these bones can actually break and lead to hearing, or not break, but be broken down and then lead to hearing loss. Bowing of the legs. Once again, we saw this in osteosarcoma, and we see it again here because of the fact that the legs become weaker. The bone that is replaced is not as strong as the original bone. Look at that. You can see right in here how we have basically osteopenia that's going on in here, which leads to the bone of the legs. If you remember, we saw a bone of the legs too in osteogenesis imperfecta. Okay, so this should all be straight. By the way, you're looking at this from the side. Here you're looking at it straight forward, but this should be from the side because I think that's the kneecap right there. Yeah, and this, so you're looking at this actually from the side too. Radiographic findings, I've already shown you some, but these are kind of interesting on this. Osteoporosis circumscripta, radiolucent areas of the lung, because of the fact that we've replaced part of the skull with bone that's irregular bone and weaker bone. So it looks like this on x-ray. So this is still has bone here, it's just weaker bone that has replaced the regular bone. Okay, the cotton wool sign, you can see how we have areas here because of the fact that, once again, we've replaced some of the bone with weaker bone. And the weaker bone shows up almost like this cotton wool appearance that's on there. Sometimes you'll actually see, you can see how it's sticking up a little bit here too. You can see bone that's sticking up from the top of the skull too. Picture frame vertebrae. So if we look here on picture frame vertebrae, this is it. This is it right here. That's a picture frame vertebrae. And the reason being is because the bone that was in the center of the vertebrae has been replaced with immature bone once again. And so it's easier for the x-ray to shoot through the immature bone, leaving a picture frame vertebrae. Okay, chalkstick fracture. We've seen these several times. This isn't really a big one, but this has been fractured right along here. That's a fracture. Another chalkstick fracture right here. It's just a break in a long bone. And there's a lot, you're going to see, this is also known as a complete fracture when we get to fractures, which are coming up. Okay, but usually it's a fracture of long bone. All right, and so now we're going to start talking about fractures.